people understand, like, there are things, going on inside your body that, can be corrected.
My uncle got esophageal cancer, and talking with the doctor who he had a really good relationship with at that point, the doctor pretty much told him, had he been proactive in the acid reflux and taking care of the GERD, more than likely it wouldn't have been progressed to that amount.
It was just, it was eye-opening, I guess. Hard to say, it's the realization is once, someone does pass away from it close, it's, you understand, especially when you have all the pains and signs, you just wonder, is it something that's coming for, be next for you?
No matter what I would take, it would just still have all that burning in there.
Actually didn't really think that there was anything that could be done. I thought it was just something that I had to deal with.
As soon as I laid down, I'd end up, waking up at night and just aspirating. And I aspirated so much that I was starting to lose my voice.
I sought some help and was diagnosed with GERD. Before that, it was just, a thing I dealt with. But then it became something that actually had a name. We live in a very rural area. So healthcare was 2.5 hours one way if you wanted anything besides your blood done.
After I seen one provider, I believe it was an upper GI I did in Marquette, and I forget who I was talking to, but they were the ones that suggested that I check out this new guy up in Iron River, because he's doing that new procedure, the TIF procedure.
GERD is an insidious disease. It progresses gradually. Patients don't realize how much the disease controls them. They start by eliminating certain type of food. This disease affects 1 in 5 Americans. In rural setting, we see it very often.
Definitely welcoming to know that somebody out there had actually, other than just patch me up with a pill. It was a procedure out there that actually was meant for this.
So the TIF stands for transoral incisionless fundoplication. It's a procedure that done through the mouth. We recreate a valve. We wrap the stomach around the esophagus, but not completely. So in this way, the patient can belch, can vent.
When you sit down with Dr. Farnoose, just how he explained it, just the procedure, how invasive it was the biggest thing. He made me feel like this was definitely a procedure that was built towards me, because the way he's going to create the valve and all that, it's more naturally, I feel like. I was pumped. I was ready to go for it. I couldn't move that well for the first 2 weeks, so I was pretty much stuck on the recliner for the first 2 weeks, drinking broth.
When he was healing, I of course was teasing him because he couldn't eat anything.
The first few weeks of recovery was a little harsh, so they looked at me then, but it was after about the week 6, 7 where they were more interested.
He felt amazing, and he was eating things again, and I couldn't tease him anymore because I was still hurting and he wasn't.
Since I've had the TIF procedure, I've got to actually enjoy sleep. I got to enjoy food, and I got to enjoy just my all-around activities, because acid reflux, GERD, that burning sensation, that's the thing of the past.
Well, then when I could see that he was good and he wasn't swallowing and choking and aspirating at night anymore and he could sleep, then I was like, yep. And then Dr. Farnoose, he was like, yep, no more pills for you. He said, you definitely have it, and he showed me the pictures of how bad it looked in there. I didn't even realize I had hiatal hernia until I went in there, and he found that too, so he fixed both of them in one shot.
Watching both of them come out of it, they lost weight, they were feeling good, they were eating the foods that they wanted to. Yes, they told me the recovery wasn't the most fun part. However, you've got to decide if you want to suffer for a little bit or a long time.
After my TIF procedure, I could breathe great. I could feel great inside my stomach. I could eat what I wanted. It was amazing for my sleeping habits, for to be able to work. When I was working, I wasn't exhausted anymore.
Since I've had this, I have probably told 30 people, that they're saying, oh yeah, I've got that problem, and I just don't have the time. No. Go see Dr. Fanous at Aspires in Iron River. I've told people, like, look, my uncle died, and look, this is how I feel now. Or the people that see me and they're like, wow, what happened to you? I'm like, go, do it. So definitely send them up there. Get this procedure done. It's a minute in time compared to the rest of your life.
I think it's a testimony to my team more than me personally. We literally a hospital in the woods. We have 25-bed hospital.
We're one of the few rural centers with a comprehensive treatment program. So we do a full range of diagnostics and interventional procedures. We're a high volume center in our first year of operation. We've had over 20 publications in 5 years, which for a rural community is unheard of. That's for university hospitals typically. And really what is neat is that we get to see people when they come in suffering and after treatment with remarkable improvement, smiles on their faces. These 3 family members who decided to have care here are just amazing people, and we were so glad to see them get back to their lives in the way they wanted to live it.
When the patient has a good experience, meaning that they came to a hospital, everybody treat them with respect. These are the people that I work for.
We performed hundreds of these procedures and helped so many family members and couples. For us, the story of the 3 siblings is the most satisfying.